So today I'm going to be talking to you about organ donation and the organ donation process. So this is a visual that shows that one organ donor can save up to 8 lives. Now the first question most people ask about organ donation is who can be an organ donor? And the answer is anyone. Anyone from a newborn all the way up to a senior citizen. But there's different ways of signing up for the different age groups. So if you're between 16 and 18, you can sign up at your local DMV or you can sign up online. But if the occasion arises, your parents actually will still have the final say on whether your organs are donated or not. If you're 18 years or older, then you still sign up the same exact way, but your family is left out of it. If you decide you want to be an organ donor, that's your decision and your family can't change it. And if you don't want to be an organ donor, then your family can't change that either. Also, newborns, they do not sign up technically to be an organ donor. So what would happen is, let's say a newborn baby was born and one of their lungs was not functioning and they needed a lung transplant. Well, that newborn can't get a lung from an adult or a 10-year-old or even a 5-year-old. They need to get a lung from a newborn because the lung has to be the same size as their other lung and it has to fit in their body. So if another newborn happens to pass away, then the doctors will actually ask the parents whether or not they want their newborn's organs to be donated. And if they do, the organs are donated, and that newborn, if they don't reject the organ, will get to keep that lung for the rest of their life. The lung actually grows completely normally, and no one would ever even know that they had the organ donation. Another question people have is, what if I have a health condition? Can I still donate my organs? And the answer is probably. Your doctor or physician will have the final say. They'll do tests and they'll examine you to see which organs are viable, if any. The only real reason that you can't donate your organs is if you have an active form of cancer when you happen to pass away. So, I'm going to talk about what you can and what you can't donate. So you can donate almost all of your organs. You can donate your heart, your lung, your liver, your pancreas, your kidneys. Not normally your large intestine, most of the time it's your small intestine. As for tissues, you can donate your corneas. If you donate your cornea, you can actually restore the sight in somebody who has lost their sight. For tissues, you can do tendons, valves, veins, and skin. I know skin seems a little weird. Most of the time people decide not to donate their skin. You donate your skin, you may want to be cremated instead of having the whole open casket. It's up to you. I actually had a cousin who was in the medical field and he passed away, donated everything, including skin, but he did it from the waist down, so basically just his legs. So he still had an open casket and we actually were unaware that he even donated any organs until after the fact. You can also donate bones. Normally it's your bone marrow for somebody who has leukemia, which is a cancer of the bones. Also now they're doing hands and face transplants. There's only been 125 done in the world, but it's up and coming. And one other thing that's not listed on here is your blood. You can donate your blood every 56 days. So when I polled the class, about 80% of the class was either unsure or unaware of the organ donation process. So I'm going to use this visual to go through the process. I picked brain injury because it's kind of the easiest way to go through the process. So the first thing that happens is a patient will come into the hospital with a serious brain injury. They'll come in, they'll be put on mechanical support, which continues to pump the oxygen in the blood through the body to keep your organs moving. Then the medical team is going to do everything they can to save you. At this point, they don't even know you're an organ donor. No one's like, oh, let's get out the wallet, see if you're an organ donor. They have no idea. So they're doing everything they can to save your life. If they decide that they can't do anything, then the doctors are going to try and diagnose you with brain death. So brain death is irreversible. If they say you're brain dead, you are not coming back. That means you cannot breathe on your own and you have no brain waves functioning. So they're going to do the test and decide whether or not you're brain dead. If you're brain dead, then they're going to call the OPO, which is the Organ Procurement Organization, which is a fancy word for the Organ Donation Organization. They're going to give them your age, any comorbidities you have, which are any pre-existing illnesses, and they're going to give your family history. That organization will then decide if, well, maybe we can take their organs. So if they decide they can take your organs, they're going to send somebody to the hospital. Now, as they're sending somebody to the hospital, the doctors are going to do everything they can to find out whether or not you are an organ donor or not. First thing is they're going to check your license, see whether it says organ donor on your license. Second thing is they're going to check a living will. So on your living will, you can check whether you want to be an organ donor or you don't want to be an organ donor. If you do pick you want to be an organ donor, you still have the option of specifying what organs you do or do not want to donate. My mom just filled out her living will, and she put on there that all the internal organs are okay to donate, but she doesn't want her corneas donated and she doesn't want her skin donated. And that's fine. You can pick whatever you're comfortable with. So after the family discussion happens, the medical examination of the deceased patient is going to happen, and that's going to happen with the organ procurement team. They're going to come in and look at your organs, see if they're still, you're still going to be on the mechanical ventilator. So they're going to make sure that organs are still working properly. Once that is determined that is okay, then there is an online database. So the doctor is going to go to the online database and they're going to put in your name, or not your name, they're going to put in your age, the sizes of your organs, your blood type, things like that. And that is going to bring up matches of people all across the country that could match with you and your organs. The top person that comes up on the list, who's going to get your organs. So once that is figured out, you're going to go, it's the organ recovery. So you're going to go to the operating room and the surgeons are going to take out your organs. And they do so very respectfully. They make the smallest incisions possible, they take very good care of your body, and they take your organs out. Next, it's going to go to the transport team. Now, organs cannot live outside of your body for a very long time, so this has to be fast. So it's either ambulance, helicopter, or airplane. Most of the time, if you're within the region, they're going ambulance, but the helicopter is also very, very useful, but it depends what hospital you're at, because not all hospitals have the helicopter capability. Next, it comes the transplantation. So once the organs arrive at the next hospital, the patient who's receiving the organs is normally already in the operating room, ready to go. The organs are quickly moved through the hospital to the operating room, and the surgeons will place the organs inside of the body. So I'm going to do one myth that, when I pulled the class, seemed to be a hot topic, which is if they see I'm an organ donor at the hospital, they won't try and save my life. I'm going to speak from personal experience, and I talked to Rich, who is in this story, beforehand, and made sure it was okay that I used his name in his story. So as most of you all know, I'm in nursing school here at Delaware County, second year. So a year ago, we were on the bus on a shuttle from the hospital to the parking lot. It's about a 10-minute drive. So we were on the bus, and we were sitting there, and it was just us nursing students, and a girl from the back of the bus says, "Is anybody here in the medical field?" We all just kind of looked at each other like, yeah, we're about 3 weeks into the nursing program, but none of us worked or anything, so we didn't really say anything. Then she screamed, "Somebody needs to come back here and do CPR now." So myself and this other girl got up, went to the back of the bus, and noticed that one of our classmates, Rich, who was older, was not breathing. He was turning blue, his lips were blue, his face was blue, his ears were blue. So we got him onto the floor of the bus, and if you've ever been on a bus, you know that those aisles are not very big. Like myself, I have to turn and get down the aisles, and we were getting a full-grown man down onto the floor. So we started doing CPR on him. Another girl called the ambulance, called 911. 911 came. When the paramedics came on the bus, it was 2 paramedics and a police officer. I was the one that was giving CPR at the time, and they said, "Keep doing what you're doing, don't stop, we'll work around you." I was like, okay. I didn't even really know what I was doing. I didn't know if I was doing it right or not, but they said, keep going. So the first thing they did is got their scissors, cut off Rich's shirt. When they cut off Rich's shirt, everyone stopped. We all saw he had dog tags on, and they said, "Organ donor." Turns out Rich is a paramedic, so he was very pro-organ donation. So I saw it, the paramedic saw it, the police officer saw it, and the girl giving mouth-to-mouth saw it. Nothing really happened. We all kept doing our job, we kept going. They put the AED pads on Rich, they shocked him, they brought him back. As they were taking him off the bus, he stopped, his heart stopped again. They got him into the ambulance, they shocked him again. Took him to the hospital. On the way to the hospital, his heart stopped, they shocked him for a 3rd time. Once they got to the hospital, he went straight to surgery. He ended up having open heart surgery. But everyone did their best, and he's still here to live and tell his story. All right, and then this is just a quick story, Caitlin's story. It's about a 6-year-old girl who got an organ transplant.
My name is Caitlin. I'm 6 years old. I like to go to the beach with my cousins. When I was a baby, I was very sick. And then I got a liver transplant from an organ donor. He saved my life.
This gift of life was made possible by an organ donor. Imagine what you could make possible. Sign up as an organ, eye, and tissue donor. Go to organdonor.gov.
So, in conclusion, becoming an organ donor is a huge decision, but in doing so, you have the opportunity of saving up to 8 lives.
My daughter's name is Caitlin.